like you all to picture a woman going into labor. Most of you probably think of her being rushed off to the hospital, and once she gets there, she's probably given something for pain, maybe, maybe not. But it's very likely that she's going to be hooked up to an IV, and then she's going to be hooked up to lots of fetal monitoring stuff throughout the entirety of her labor and delivery to monitor how her vitals and the baby's vitals are doing. What if I told you that those interventions actually increase the rate of delivering via C-section? I personally would not choose to deliver in a hospital just because I want to avoid all of the interventions that I can and deliver as naturally and comfortably as possibly as I can. And as some of you may know, Joshua and I are actually 15 weeks pregnant and we're planning a home birth. Unnecessary birth interventions should be avoided as not to increase the risk to the mother of the child, especially in low-risk situations. Today we're going to talk about some of the unnecessary interventions that are used, why and how we overuse these interventions, and how education and a doula reduce the risk of the overuse of interventions in hospital births. Let's begin by talking about these interventions. Many women are subjected to unnecessary interventions when giving birth in a hospital setting, even when they're considered low risk. Since 1965, the C-section rate in the United States has increased. According to a document published by the National Partnership for Women and Families, in 1965, the C-section rate was just 4.5%. By 2014, that number had skyrocketed to 32.2%, an almost seven-fold increase in the rate of C-sections in the United States. Since 1985, the World Health Organization has suggested that the C-section rate stay between 10 and 15%. Interventions when are sometimes medically necessary for a mom that's high risk or a baby that's in danger. So it is important to have them. It's just not that they shouldn't be used in every instance, and they definitely shouldn't be used as an elective option. This chart shows the increase in C-sections from 1970 to 2006. 1970 it was 5.5%, and in 2006 it was 31.1%, and this information was taken from the CDC website, or also known as the National Center of Health Statistics. Inductions are one of the interventions that are used most commonly in the United States. A lot of women go in and their doctors tell them, well, you're overdue, or why don't we just induce you? And when they do that, what they do is they intravenously give you Pitocin. And Pitocin is a synthetic form of oxytocin, and what oxytocin does is start labor. It softens the uterus, it starts the contractions, and it just kind of starts moving things along. But the difference between Pitocin and oxytocin is that Pitocin makes your contractions a lot stronger and a lot harder for a lot longer of a period of time, so it can actually put your baby in distress. According to an article on the Consumer Reports website, in a 2011 study, women who were induced without a recognized medical reason were 67% more likely to have a C-section, and their babies were 64% more likely to wind up in the neonatal intensive care unit. Epidurals is another one of the interventions that are often used that you hear of a lot. Women go in, and it's to help control their pain. What it is a pain medicine inserted directly into your spine via a really long, scary-looking needle that they say you really shouldn't look at before they're going to do it, because otherwise you might just be scared. According to the same Consumer Reports I quoted earlier, the risk of an epidural is that if you get it too early on when you go in, you get it too early on in labor, it could reduce you being able to feel it all to push. And if you can't push, then your baby's going to just be it's going to be in there and having problems, and then you're probably going to end up having a C-section, or they're going to have to use another intervention to help get it out. And the other thing is epidurals actually slow down labor, so you're counteracting everything that you're doing when you go in and get an epidural put in. Now I'm going to show you a short video from the movie called The Business of Being Born, which I highly recommend watching for anybody that's considering having a baby. And it just shows what happens when you use some of these different interventions. Kind of a fun graphic, I guess.
In the hospital, you're not allowed to have very long labors. So if you're not dilating rapidly, which you're likely not to do if you get an epidural early in labor, you will give a Pitocin. Put the Pitocin in the IV, it will flow into your veins. Pitocin makes contractions longer and stronger and closer together. So then the pain of labor is much worse. So you go with that for a while because you have the epidural, but eventually the pain of the contractions is overwhelming the epidural. You need to up the epidural, and then labor slows down more because of that, so then you need more Pitocin. Now you're not feeling the pain of the extra Pitocin because you've got the epidural, but your baby is getting compressed blood and oxygen supply because Pitocin contractions last so long and are so strong, the blood and oxygen flow to the baby is compromised. So then the baby's likely to go into distress, and then you're set off for an emergency cesarean from a baby in distress from contractions induced by the Pitocin, which was necessitated by the epidural.
Step by step, one intervention leads to a series of interventions, and the net result is the mother finally ends up with cesarean, and everybody says, thank God we were able to do all those interventions to save your baby. The fact of the matter is, if they didn't start the cascade of interventions, none of that would have been necessary.
Okay, so now you're probably asking, how did we get to this point? How did we go from thousands of years ago when babies were just born in fields with no problems and there wasn't all these drugs and fancy tools, to now we've got all these fancy tools that are supposed to help mothers that are high risk or they're truthfully in trouble and they're just being completely overused. Understanding situations where unnecessary interventions are used is really important because then it can help you make informed decisions when you yourself, or your partner goes into labor and you're at the hospital and they're saying, well, we think that you should do this, but they don't really give you a good reason, or there's not a strong medical reason, then you can say, I don't know about that. So to start explaining how we got to this point, I'm going to start with the history of midwifery. In 1900, midwives attended half of all births, the other half was attended by physicians. By 1935, that had dropped to less than 15% of births were attended by midwives. There was a study concluded that said, between 1915 and 1929, there was a 41% increase in infant mortality, but it was due to obstetrical interference, not just because babies were dying more. It was because they were doing things that, actually during that time period, they introduced a thing called twilight sleep, which is a whole nother topic, but they essentially just gave you a mix of like morphine and opioids and all this stuff, and it put you into this crazy daze and you just wouldn't remember any of it. And women were all for it until they found out later on that it was just like really terrible for everybody. Another reason that we've kind of gotten to the point that of the unnecessary interventions is there's a lot of mothers that actually choose to even have a C-section, which is considered a major surgery. And when they called that, it's kind of been coined a designer birth. And it's kind of it's really popular in larger urban areas where business women, they work really hard. So what they do is they call up their doctor and they're like, all right, well, I'm pregnant and I should be due around this time. They usually schedule it about a week early, around 39 weeks or so, and they go in and they just go in for their C-section just like it's no big deal. The baby's born just on everybody's schedule, and then they all go about their lives right after that. It's really dangerous. It's not, it's still a major surgery. C-sections are a major surgery. There's tons of risks involved with it, and it should really be something that's thought hard about, and it should be done for necessary reasons, not just because it's convenient for the doctor and the mom. Another reason that we've kind of gotten to this point of overusing unnecessary interventions is doctors actually kind of encourage designer births. According to Bundu.com, A vaginal delivery costs from $9,000 to $17,000, and a C-section costs between $14,000 and $25,000. So not only is there a monetary benefit to it, if you think about a woman that goes into labor naturally, she's at the hospital for what, 14 hours before she delivers, so the doctor's waiting around thinking, when's this baby gonna come, right? And so if they can just schedule the C-section, they know when the mom's gonna show up, the mom wheels in, the doctor does his job, 20 minutes, the baby's out, and he can go on with his other patients. And we all know that time is money, right? So he's saving himself time, he can move on with other patients, and the mom, you know, she just gets whatever she wants done right on her own schedule as well, and they can all move on about their lives, and hopefully nothing goes wrong, right? The other reason that I'm just going to talk briefly about is that doctors kind of encourage a lot of these unnecessary interventions is for fear of malpractice, and we as a society have created that, and you can't really blame that entirely on the doctors, but they're so worried about getting sued for not doing enough to help somebody out that they will just say, okay, well, maybe we should just do this, we'll just induce her labor, so that way, you know, if something's really going wrong, then she can't say that we didn't try anything, right? You know, so then, well, if something happens, it really wasn't our fault, we did everything we could, right? So we tried everything. Well, a lot of times those things are actually just gonna make it worse. You're gonna just put the mother even at more risk and the baby even at more risk, when you should have just let her be and let it go. Next I'm gonna talk about ways to avoid unnecessary interventions. The most important thing is to just become educated, learn the risks of things associated with all the different unnecessary interventions. You have to know that with every major surgery, there's a risk of death. So I mean, if that's something that you're willing to just forego, just to have your birth whenever you want it, versus just have a vaginal delivery, you know, and you'll be fine. So to educate yourself is, like I said, one of the most important things to make sure that you don't end up with some of these unnecessary interventions. The best way to avoid all of them altogether is to just do a home birth with a midwife, like Joshua and I said. If we're not in a place where they can hook us up to all these machines and make everything beeping and going off around us, then if it's not available and somebody can't push it on me, then fine, it just won't happen, you know. The other thing that you can do is get a doula, and a doula is not a medical professional. She's basically like a birth coach. She comes in and she's pretty much your advocate. She'll be your go-between for the mom and the dad. She comes to the hospital with you. If the doctors come in, you know, and say, hey, well, we think it's time for a C-section, the doula can kind of say, all right, well, you know, that's not the route that they wanted to go, and unless you're saying that they're in true medical danger, then we really want to avoid that situation altogether. So let's just skip that, you know, or whatever. And so she's really just your advocate, your voice, because when you're in pain and you're delivering a baby, a lot of times they can say something that will just scare you, essentially, and then you're off doing things that you weren't ever planning on or intentionally doing. According to an article on the American Pregnancy Association website, studies show that having a doula present decreased C-section rates by 50%. It decreases the length of labor by 25%, decreases the use of oxytocin by 40%, and it decreases the request for an epidural by 60%. So you can see why just having this extra doula lady hanging out with you in the hospital would be really beneficial to both you and your partner if what you're doing, if your goal is to have a natural birth. And even if that's not your goal, if you want to go in and you want to have pain meds, and having a doula there, as long as she knows your birth plan, she's just really your advocate. She's there for you, to stick up for you and make sure that your birth goes the way that you had planned. As much as you can. Obviously things happen, and obviously there's emergencies and there's needs for all of these interventions. It's just that making sure that those are implemented at a time when it's truthfully necessary and not just because it's convenient for the mom or the doctor. The third thing that you could do is just choose a doctor that their views and ideas really mesh really well with yours. A doctor that has a good track record for letting women just birth naturally. And then the last thing that you can do is just research hospital policies. some hospitals, you would be really surprised that there's hospitals in New York, even though our national average for C-section currently is right around 32%, there's hospitals that have a C-section rate of over 70%. It's really scary because you think you're going to go in there and you have a 70% chance, whether you want it or not, of ending up with a C-section. And it's like, what? How is that so skewed? How did that get so far away from what the World Health Organization says it's safe at 10 to 15%? So if you research that and you find out, well, wow, that hospital, you know, that's not really what I want and I'm not really happy with that, then you can choose a different hospital, you can choose different doctors. It's all about you, your care. Remember, you're in charge and you're the boss. You hire the doctor and he works for you. Although they're smart and they've gone to school forever, you're in charge of your own care. So let's review a little bit. I've explained the interventions and how they affect the outcome of labor and delivery. We've talked about how the overuse of these interventions has come to be and how to avoid them in low-risk situations. And as I said, low risk is really the key here, because if you're a high-risk patient, then you really just, you know, you've got to do whatever you can to deliver safely. And that's really the whole idea in the end anyways, is that you and your baby come out of it in with the best possible outcome. Like I said, there are some cases where C-sections and interventions are necessary, but we just must be very careful not to overuse them. Thank you.